presentation is COVID-19 and the disability community, lessons learned and advocacy moving forward. So Disability Rights Michigan is Michigan's federally designated protection and advocacy organization. So what that means is that there is a protection and advocacy organization in every single state and territory in the United States. That's because it was mandated by a federal law in 1975, the Developmental Disabilities Council and Bill of Rights Act. So there is a protection and advocacy organization in every single state and territory. Some of them go by protection and advocacy, and some of them go by disability rights, whatever that state is, like us. But it's funded. Over 95% of our funds come from federal funding, and it's mandated by the law to be funded by federal funds. And then we serve the entire state of Michigan. So that's something that I think is really special about our organization, is that we serve people with any type of disability anywhere in the state, and we're independent, meaning that like we aren't housed in an umbrella organization. We're not government. It gives us the ability to be really impartial in the way that we advocate for people. And we receive over 4,000 calls a year. Okay, so our vaccine advocacy program is a time-limited outreach program, and it's funded by federal and state grants to help people with disabilities, family members, and caregivers get vaccines. And so the goals of our program are to better understand the barriers facing people who have lower rates of vaccination, partner with communities to help people get vaccinated, improve access to vaccines, and improve messaging around vaccination. So the first section is the lessons we've learned. And this is mostly about the disproportionate impact of COVID-19 on people with disabilities specifically. And this is leading up to the time that the vaccine advocacy team and program began. So this is before we existed, early in the pandemic, that we learned about the disproportionate impact on people with disability. So one of the things that we learned is that people with disabilities are at higher risk. And there's the picture here in Time magazine says this is really life or death for people with disabilities. Coronavirus is making it harder than ever to receive care. And one of the reasons that people with disabilities were at higher risk is because many people with disabilities live in congregate care settings, like nursing homes or adult foster care homes, where they're living with a lot of other people. And this New York Times article says nearly 1/3 of US coronavirus deaths are linked to nursing homes. Communication barriers was another major challenge. Deaf, hard of hearing, deaf, blind, and blind individuals experienced great communication difficulties as masks became commonplace, making lip reading impossible and sign language harder. And so this is not to discourage mask wearing, but it's just one of the many ways that people with disabilities were impacted, because when people started wearing masks, they didn't always consider the fact that without a clear view mask, people that rely on lip reading couldn't necessarily understand what somebody was saying to them. And then the caregiver crisis. There was already a shortage of caregivers. I'm sure that many of you are aware of this before the pandemic, due to the fact that the benefits and the pay for direct care workers is already low compared to other fields. And so many caregivers were already leaving the profession to work in a job where they could make more money or get more benefits. And then when the pandemic hit, that made it put them at even higher risk of getting an infection, getting COVID-19. And so it even further lessened the benefits of working as a caregiver during this time. So the article here, title is Staffing Shortages Undercut Caregiving Industry for Those with Disabilities. Students with disabilities were also cut off from critical in-person education services and support. And so we know that when school went virtual, there are a lot of students with different types of disabilities that relied on in-person services and couldn't necessarily use the virtual system that they started using to get their education services. And they were given, people with disabilities that went to school were given last or no priority when they attempted to preserve education through alternate means. And then mental health disabilities were made worse. The anxiety, the social isolation, that exacerbated the mental health issues that people were experiencing prior to the pandemic. So now to get to the better part of the presentation, how we're addressing these disparities with vaccination and healthcare, access to vaccination and healthcare for people with disabilities. It's first important to understand the timeline. So the COVID-19 pandemic reached Michigan in early 2020. And Governor Whitmer closed schools down in March of 2020. I'm sure you all remember quite well when that time happened. And then the first COVID-19 vaccination shot didn't become available in Michigan until early 2021, so a whole year later. And all adults became eligible to receive the first shot in April of 2021. And then it wasn't until November 1st of 2021 that DRM received the grant funding. And this is grant funding that specifically addresses populations who are disproportionately impacted by COVID-19 and people with disabilities. It wasn't until November 1st that they were able to form a vaccine advocacy program due to receiving that grant funding. So why are we working on vaccination? Right? Why do we support vaccination? It's because of the scientific evidence. Because as this graph shows, and this is up to date, this is showing April 3rd through May 22nd of this year. And it's from the COVID-19 dashboard on the CDC website. So this is the whole country. And you'll see the numbers on the left side of the screen they don't look that significant. 0, 2, 4, 6. This is deaths of people who are unvaccinated versus those who are vaccinated. And you can see that the black solid line that represents unvaccinated people is starts off at over 2 and it peaks up near 6, but that's not 6 total. That's that you see here on the left. It says incidents per 100,000 people. So that's deaths per 100,000 people, and it's actually there's over 330 million people in the United States. So it still might not sound like that many to say, well, it's only, 5 deaths per 100,000 people. That doesn't sound like that many. But you have to multiply that number by over 300 to get to the actual number of people that die in the United States. And this is on a weekly basis. So as you can see, much, much higher for unvaccinated versus only those who got the primary series. So the first 2 shots are down here at the dotted blue line. And then even lower is the dark blue line, which are those that got their first shot plus 1 booster dose. And then the purple on the bottom, which is almost at 0, is those who had the primary series and 2 booster shots. And I'm sorry, I forgot to mention that last one was also, that was in ages 50 and above. And then this is ages 5+ years for the whole country. And this shows going further back from July 2021 all the way to May 2022. And so you can see where it spiked heavily for the unvaccinated around the summer of 2021, and then again at the beginning of this year with the Omicron variant. But again, the vaccinated with at least a primary dose, the blue line, you can see is pretty straight, and it has one smaller peak at the beginning of January when Omicron was out, because that did evade immunity and many people had not received a booster shot yet. But then it goes back down to being almost nothing for vaccinated with at least primary dose. So the scientific evidence is there that vaccinations are effective. And if you're wondering where does CDC get their data, they have a data system called COVID-19, and over 250 hospitals report the vaccination status of people that are admitted to the hospital with COVID-19. And so they are able to keep track of the deaths of those that are unvaccinated versus those that are vaccinated. So early in our work, the vaccine advocacy team, first they gathered information to create maps to help guide our advocacy. So these maps took into consideration things like the vaccination rate of an area, disability prevalence. We also looked at other what's called social vulnerability indices. So we know that certain groups of people, certain races, ethnicities, age groups, etc., have different, it had a different impact on them than it did the general population. So we wanted to focus on the areas that were most vulnerable and had the lowest vaccination rate. And this is just one example of one of the maps that we made with the help of the Phoenix group at Wayne State University. This is Detroit. This is the city of Detroit. And it's showing vaccination rate overlaid with disability prevalence. So this bright blue color in the lower right-hand corner of the key of the legend is showing where the disability prevalence is high and vaccination rates were low. And so that helped us be able to focus on the areas of Detroit where the vaccination rates were lowest and disability prevalence was the highest. We also began building relationships with health departments and community organizations and other disability focused organizations throughout the state to let them know, hey, we've got this program, we're trying to help people that might not have equal access to vaccinations get help getting vaccinated if they need it. And just helping to spread the word. And then we created a COVID-19 informational packet for clients and callers that call our information and referral line and had questions. And we also created an vaccine advocacy landing page on DRM's website. So if you go to disabilityrightsmichigan.org and then go to resources, under the resources tab is vaccine advocacy, and you will find lots of information, answers to frequently asked questions. There's a video with sign language interpreter talking about the program and how everyone has a right to get a vaccine, even if they're not able to leave their home. So we did a survey as well early this year. I believe it was February to March, February 1st, I believe, to March 30th, that we had the survey go out. And it was online, but we also gave the option, and it said this at the beginning of the survey, that if you wanted to take it by phone and have the questions read to you, or take it on paper, we could mail a PDF version of it. We had every format available for people to take it. So we ended up receiving 155 completed survey responses. 42 of those were from individuals who had disabilities themselves. The other ones were people that were either a guardian, a parent, or relative of somebody with a disability, or they could have been a caregiver or some other type of professional relationship where they work with someone with a disability. And both vaccinated and unvaccinated respondents reported access issues for vaccination, for getting vaccines. The vast majority of people that responded to the survey were vaccinated. About 92% of the respondents were vaccinated. But even those that were vaccinated reported having some difficulties. So these are the access issues that were identified in order of their occurrence, or how many times, the frequency that they responded. Guardian consent was actually the highest cited access issue. So people whose guardians would not consent to allow them to get the vaccine. Registration issues was the second. So, registering for a vaccine online through a pharmacy, or another appointment setting mechanism, it could be very, very cumbersome and didn't always even function correctly. Sometimes the websites were not accessible for people who were blind or had a visual impairment. Sites not being sensory friendly or overstimulating, having an overstimulating environment was one that was cited in the survey. And that ended up being a bigger issue than we originally thought that it would be, because we had a multiple choice selection, and then an area for people to write in other comments or other reasons if the access issue was not listed as one of the multiple choice options. And is that wasn't one of the options that we were originally thought of. But a lot of the write-in responses indicated that the sensory issues were a big issue. You know, a lot of the vaccine sites, you know, were drive up. There were a lot of car smells, or a lot of noise, and for people with heavy anxiety or with sensory issues, that can be overstimulating. Vaccine availability early in the vaccine rollout. So we, as you probably remember, the vaccine was prioritized first for frontline workers, teachers and school staff, medical staff, and then they later opened it up to people 50 years and older. And then eventually, when it was open to everybody, obviously people with disabilities could get it as well. But they did not prioritize people with disabilities in most of the state until everyone else was able to get it, even though, as we've looked at in the previous slides, they were more heavily impacted. Transportation and travel issues was another one. Lack of adequate personal care supports, lack of in-home availability of vaccines and boosters. So first, you can see that some of these overlap. So, you know, transportation and travel issues may be the issue that was cited, but for somebody that has no care support, in-home care support, and can't drive themselves, you know, that could be an issue as well. There overlaps because the care giver might be the one that drives that. Communication barriers at the vaccination site and lack of physical accommodations at the vaccination site were the last of those issues that were identified in the survey. So the recommendations that we've come up with based on that survey, on the survey responses, are guardianship reform. We believe that DIR is supported decision-making or other alternatives to guardianship. And we feel that the survey responses was just one more reason why to support alternatives to guardianship, because there has also been recent reports from the Elder Task Committee that evidence, you know, guardianship abuse and neglect in the system, and that is something that we feel strongly about addressing. Continuation and expansion of mobile units. We're going to talk more about mobile units in the upcoming slides, but this mobile units is an advancement in healthcare that really addresses many of these access issues all at the same time. And further research into the identified barriers. So we're planning on following up probably in spring of 2023 with the Healthcare Access Conference. And we will not only be asking questions of people who participate in the roundtable discussion about their access to vaccines, but to healthcare services in general. And that's why this information that we've been collecting is so helpful and useful, because as we know, COVID-19 vaccines have been heavily promoted They've been made widely available. But if we're seeing access issues to something that is so heavily promoted and widely available, that can only prove all of the access issues that people with disabilities must have to access healthcare services in general. So what we've been doing, one of the main things that that we focused our efforts on is partnerships with mobile unit vendors. This has allowed us to hold vaccine and health events in communities where people that live in those communities can easily get vaccinated and get other assistance. The other assistance is that we pull in many other resources and make it a one-stop kind of shop for people who may have a difficult time getting very far outside their neighborhood. So, you know, it could be the church across the street that we hold an event at in Detroit. It could be a disability organization that people frequent. And we can have these pop-up clinics and pull in all of these other organizations that provide services or advocacy. And many times we also do giveaways. Organizations donate items, food. We can have people there that help sign up people for or apply for other services like health services like Medicaid, or apply for food assistance and so forth. We also can send mobile units to congregate care settings. And one of our early projects in 2022 was calling adult foster care homes. At first, the COVID-19 shot was required to be made available in homes that had 20 people or more. But obviously, there are a lot of homes that are smaller AFC homes that don't have 20 people. And so it wasn't required in those homes. And the mobile units that originally were funded by the state to go out to people's homes, they didn't receive the funding for the booster shots. And so we've partnered with mobile units and have used our grant funding to send those mobile units to people's homes. And that's not only AFC homes, but we also have people that have called us that can't leave their home, that don't live in congregate care settings. You know, I don't really like the word homebound, but there are people that have a hard time leaving their home. And we don't ask people to prove to us that they're homebound. There is no requirement or like they have to have a certain type of diagnosis or whatever. We know that some people, it's complicated. There's a lot of issues that they may experience and make it hard for them to get out. And that's been one of the unique, unusual side effects of COVID-19. That's actually a positive one, is that we are doing so much more virtually, which has given people with certain types of disabilities more access to do things like telehealth, doctor's appointments, working from home, and things like that. And these mobile units just complement that to actually bring the physical services to you. And to give you an idea of the impact we're having, we have done for community events, we've hosted vaccination clinics at 25 sites and have gotten over 400 vaccinations at these sites. In long-term care facilities, we visited 42 with 328 vaccinations. And we've done 113 vaccinations for people who are considered homebound, and we have 15 more scheduled. And so we're definitely having an impact on. I should also mention that this has probably already changed since I created this PowerPoint and updated it last week, because every day we are having clinics and having mobile clinics that go out to people's homes. And so we're also, it doesn't matter which shot. If a person wants to get a shot in their own home, they can get their booster shot. It doesn't have to be their first or second. It can be their second booster shot. But we will send them to them now. We are also part of a collective called the Michigan Vaccination Partners. Our tagline is Healthy Communities for All. So DRM has joined with Autism Alliance of Michigan, Brain Injury Association of Michigan, and Michigan Developmental Disabilities Institute to form the Michigan Vaccination Partners, or MVP. And what we do is we make sure that when we have what we call an MVP event, that all of the health staff that are on site, whether that be a mobile unit or a healthcare department or whatever, that they've received disability training. You know, not everybody that has a disability has had nothing but positive experiences with medical staff and medical professionals. And so we felt it was very important to make sure that when we're having clinic events, that the healthcare staff have been trained about disabilities and how we speak to somebody with disability, to always presume competence, teaching them some general etiquette and some of the history behind the relationships with people with disabilities and medical staff. We also provide accommodations for attendees of these events. So any of the flyers that we have for an MVP event tell people that if they want to request an accommodation, that they can call, and we'll make sure it's available. So if somebody needs a sign language interpreter, we'll make sure it's available. We make sure that there is going to be accessible parking where these events are held. We'll make sure that there's no barriers. There's no physical barriers for them to get their vaccination. We also are providing sensory kits. So a person that has autism and will get overstimulated when they're getting their shot, we have noise canceling headphones for them, and like fidget spinners and sensory toys that they can use to distract from the anxious process of getting the shot. We're also, and this is a really, really important part, collecting information about disability status. I don't know if any of you have ever looked at the Michigan COVID-19 dashboard before, but you can sort information on the dashboard to include age, sex, race, ethnicity, which is all very important information to know too, to understand the disparities and analyze what's going on. But disability status or disability as a demographic is not one that you can sort by. And you know, it's obvious that that is a missed opportunity because we already know that there is a severe disproportionate impact on people with disabilities. And so if there's a disproportionate impact on people with disabilities, they're definitely a vulnerable population that we should be capturing vaccination rates and other information about. And this doesn't only go for COVID-19, but this is something that we hope will have a long-lasting impact when we are working with health departments to get that information included on their intake forms, et cetera, that this is something that healthcare providers will become more conscientious about and start to include that data and their reporting moving forward with all types of healthcare services. So our clinics are more than just, they're more than just vaccine distribution. So our mobile unit partnerships are basically paving the way for long-term impact on health equity and healthcare access. This picture here is the Wayne Health mobile unit that was donated by Ford, and it's completely ADA compliant. It has a lift on it, and people can actually go up into the mobile unit to get their healthcare services or their vaccines. That's where you see that MVP logo on the van itself. And there's also here a Wayne Health mobile unit, which is one of the mobile units that we're partnered with, not the only one. But you can see all of the different types of services that they provide. They do blood work screenings for diabetes, cholesterol, kidney function, blood pressure. They provide behavioral health resources, children wellness exams, HIV screening, vital signs. They often include organizations and referrals for assistance with food, utilities, housing resources, etc. We have primary care physician referrals, patient education, we have COVID testing, flu shots, etc. Another really nice thing is that we do not require IDs. We do not require insurance. And that can be a roadblock for a lot of people with vaccines. And, you know, a lot of people that don't have stable housing may not have an ID. And you have to have an address to get an ID. And so that's an issue for a lot of people to get basic health services, even if they are free. That doesn't mean that all places will give you a shot if you don't have an ID, but we can and we do. And this list that's listed for the Wayne Health Mobile Unit doesn't even include the other organizations and community partners that we have built relationships with that also attend these events to make them more of a resource fair than just a vaccination clinic. Now, the role of peers. Like I said in the beginning, the role of peers is unique. You're a trusted source of information. People come to you, depend on you, because you have a shared, you have shared experiences. So you can help combat misinformation about COVID-19 and about the vaccines. And that's very, very important because there's a lot of misinformation out there. And, you know, people listen to you and they trust you, and they trust what you're telling them is because you care about them. So lived experience is also very important because you can help us identify barriers. Even though we've been doing a lot of research, that doesn't mean that there aren't things that we've still missed that could be a barrier to people who are getting vaccinated or getting access to other healthcare services that they need. Untapped networks. We are always looking to spread the word about what we're doing and what we can make available to people. And you can be one of those referral sources for home vaccinations, or if you're aware of an organization that may want to host a clinic event, then you can help connect us. And the people who need our services the most tend to be the most isolated and the most disconnected from traditional services and supports. So, you know, we can't take for granted that there are a lot of people that don't necessarily get disability services, yet they have a disability. There are lots of people that don't even think about their condition or their circumstances as having a disability, and that has a lot to do with the stigma that's associated with disability that, you know, we try to fight as peers. We try to show people there's nothing wrong with having a disability, but to not understand that you have a disability or not say that you have a disability, you could be cutting yourself off from getting much needed resources, support, and protection under the law and having legal rights. So this is a flyer that we have that we've posted all over the place, but we have these available if you have places where you want to hang out posters. It specifically targets those that may have a difficult time leaving their home. And a lot of times our homebound referrals come from people who attend our vaccine pop-up clinics in the community. And they talk to us. We let them know that this service is available, and then they like tell us, hey, you know, so-and-so, and they're not able to leave their home. Can you help them? And we've actually also been giving incentives to anybody that gets a shot or those that refer them. So we've been giving $25 gift cards. Sometimes they're Dollar Tree, sometimes they're Dollar General. There's certain restrictions on what kinds of stores because it comes from a federal grant, the funding for it. So anywhere with, you know, nicotine or alcohol could be purchased, we're not allowed to give that out. But Dollar Tree and Dollar General, we have gift cards that we give people that either make a referral or those that actually get the shot. This is our contact information. And obviously, if you want to get a hold of us for any reason, we have different ways of doing it. If you don't feel comfortable with making a phone call, you can use the website. There is a anonymous form that you can fill out if you have a question. And also, if you know anyone that is experiencing an issue to getting vaccinated, including if somebody needs help because a guardian consent issue, then please don't be scared to call or to leave an anonymous message on the website, because we just want to help anyone who wants to get a shot. We are never here to try to force people to do anything that they don't want to do. But we do believe in the effectiveness of vaccines, and if we want to make sure that those that actually do want to get vaccinated can and know that they have the right to do so. Okay, and now I'm open for questions. Any questions? I guess that's a no. I don't know if the person moderating. Okay. All right. Well, it's been a pleasure, everybody. And it was good to see some of you here today, even though I didn't get to see all of your faces. It's nice to hear your voices. Okay. All right. If we're all set, then I will talk to you all later. If you want any brochures, posters, any additional information about the vaccine advocacy services, I'm gonna drop my name or my email in the chat. All right, everyone. Have a wonderful rest of your day and a beautiful Friday and weekend.